අපි කතා කරමු retina. Retina කියන්නේ දෘෂ්ටි විතානය. Retina is the innermost layer and the delicate structure, mainly 3 layers, but further divided into 10 layers. The 3 layers are outer pigment epithelium, middle photoreceptor cells, and the inner neuron cell layer. Retina lines the posterior 3/4 of the eyeball, thickest at back and thins anteriorly, ends just behind the ciliary body. Near the center of the posterior part, there's an area called macula lutea, yellow spot, kahala api singaleng kiyanne. In the center of the macula, shallow depression, we call that fovea centralis, and consists of only cones. There are no rods, and towards anterior part of the retina, fewer cones than rods. ඉස්සරහට යන්න යන්න රෙටිනා එකේ තියෙන්නේ කෝන්ස් ඉතාම අඩු ප්‍රමාණයක්, රෝඩ්ස් වැඩි ප්‍රමාණයක්. About 0.5 centimeters to the nasal side of the macula, all nerve fibers of retina converge and form the optic nerve. The small area where optic nerve leaves the eye is called optic disc or the blind spot. Blind spot කියලා කියන්නේ. It has no light sensitive cells. අපි බලමු රුධිර සැපයීම කොහොමද සිද්ධ වෙන්නේ කියලා. Internal carotid form the ophthalmic artery, and that divided into the ciliary artery and the central retinal artery, and central retinal vein drains into the deep venous sinuses. The central retinal artery and the vein encased in the optic nerve. Optic nerve එක ඇතුලේ තමයි central retinal artery එක සහ vein එක තියෙන්නේ. Photoreceptors. There are 2 photoreceptor cells, rods and cones. Within the outer segment of these cells, there's a stack of membranous disc in which contains visual pigments. Visual pigments are embedded in these discs. This is the picture of the rods and cones. In the cells, there's 2 segments, outer segment and the inner segment, and there's a synaptic terminal, and as the nucleus, mitochondria, and there are discs in the outer segment, and that contain the visual pigments. Rods are like rods and cones are in cone shape. Again, this is a picture of the rods and cones, and the picture of the macula lutea and fovea centralis. In the fovea, there are only cones, and towards the periphery, there are rods. This is the picture of the retina, the layers of the retina. Mainly there are 10 layers, but basically only 3 layers. This is again the picture of the retina, the layers. You can see the pigmented layer and the photoreceptors layer, cones and rods, and the horizontal cells, bipolar cells, amacrine cells, and ganglion cells. Rods. There are more rods than the cones in retina, 16 to the 1. Numerous towards the periphery, and visual pigment is rhodopsin and very sensitive to the lights, used when light is low but do not distinguish colors. They enable us to see at night but see only black and white, monochromic vision. Rhodopsin degraded by the bright light but quickly regenerated if there is adequate supply of vitamin A. Cones contain rhodopsin as visual pigment, provide sharp, clear color vision, and less sensitive to the light. Bright light needs to activate them. There are three types of cones that has different sensitivity to across visible light spectrum and provide optimal response to the red, green, blue light. Color blindness. In color blindness, they can see colors but can't differentiate the colors. It's more in males. This is because light sensitive pigments are abnormal. What do we mean by the dark adaptation? When we expose to a bright light, the rhodopsin is completely degraded, and this is not affect the vision in good light because the cones are stimulated by the bright light. But when we move to the dark room, light intensity is insufficient to stimulate cones, and that cause temporary visual impairment while rhodopsin regenerate within rods and the normal vision returns.